Hello physios, I welcome you all to our channel Physio Vidyapit. We are back with our next lecture on ultrasound therapy. Okay, so here we are going to study about different methods of application of ultrasound. So my name is Vijay Kumar and let's get started. So the first method is the direct contact method. Okay, so here the ultrasound, that is the transducer head, is placed in the direct contact to the part where we want to apply the ultrasound. Okay, so this is the diagrammatic representation. This is the skin, then couplant which is used, and couplant is thixotropic gel. Okay, and what is the meaning of thixotropic gel? It is a type of gel which become liquid. So gel is converted into liquid when vibration is applied. When vibration is applied, and who is doing vibration here? The transducer head is producing the vibration, as I have explained in the production of ultrasound. The crystal move back and forth which produce vibration. So you can be asked that which type of gel is used. So you need to answer the thixotropic gel. And what is the property of thixotropic gel? A thixotropic gel is a type of gel which is semi-solid, that is jelly-like consistency, and it get converted into liquid form when vibration is applied. Okay, so this is the treatment head, then couplant, and then is skin. So this is the most common method which is used for the application of ultrasound, and the movement of the ultrasound head can be the concentric circles as in this diagram. Okay, then figure of 8 method, then overlapping circle method, then transverse stroking method. Okay, you can rotate it like this: overlapping circle, that is the concentric circle, sorry, and this one is overlapping circle. This is figure of 8 application, and this one is the transverse stroking. You need to focus that at what speed you are moving the ultrasound head. So the standard speed is 4 centimeter per second. Okay, which is not much fast and not slow, which allow for the ultrasound to get penetrated inside the tissue for the various therapeutic effects. Okay, so this is the first method of application. Next is the water bath method. Okay, water bath method. So first of all, you need to understand that why we are using this kind of method. If we are having the direct contact, there may be some instances when there is so much tenderness at the affected part that the patient is not allowing you to touch it. Okay, so if the patient is not allowing us to touch the part, how can we place the ultrasound head? Okay, and how can we give the treatment to the person? So in that case, we are using the water bath method. We will take a basin which can be either plastic or metal filled with the water. We will, for example, at the application on the feet. Okay, and also another important part, that where we are using this method is on the bony prominences. Okay, and on bony prominences. Okay, see the next application, which is the water bag application, that is also at bony prominence. But what is the difference between these two, water bag and bath? In the water bath method, we are not touching the transducer head to the skin. So where there is a lot of tenderness and it is a bony prominence, there we can use the water bag method. And the part where the site of application is bony but tenderness is less, then we are using the water bag method. Okay, so this is the water bath method. Okay, so this foot is dipped in the basin which is having water, and then ultrasound is applied. You need to understand that the distance between the transducer head and the feet is 1 to 2 centimeter, and the transducer head should be perpendicular to the side where we want to apply the ultrasound for the better irradiation, so that better penetration can occur. Okay, and you need to understand that this basin or this utensil which we are using can be either plastic or metal. But if you are using the basin which is of plastic material, okay, here plastic can absorb some of the ultrasound wave, so we need to increase the dosage by 20 to 30%. Okay, so 20 to 30% dose is increased in the water bath method. Next is the water bag method. Here this part is skin, then there is couplant, then there is a bag, plastic bag, thin plastic bag. Also we can use condoms here to fill the water inside it and we can apply it. Okay, and then again we are applying some coupling media, then the transducer head is placed. Okay, and we are applying the ultrasound. Okay, it is used to apply ultrasound at bony prominences. Okay, so this is the third method of application. Next is application on open wound. Okay, open wound. Here you can see that this is the skin and this is the open wound area. Here we need to cover the open wound by the sheet of polyurethane or polyacrylamide agar, which here is acting like a coupling media, and then we can apply the treatment head for the application. Okay, so this is the fourth and last method. And other coupling agents are, okay, normally we are using the thixotropic gels, and two more are polyurethane agar and polyacrylamide agar. Next is we can use oil, which can be mineral oil or even vegetable oil can be used. Okay, so oils can be also used as coupling media. Okay, so this was the fourth type of application. Why we use the sheet here? Because if we will directly apply the ultrasound on the open wound, it may produce the skin irritation. Okay, so initially the wound is open and we are again applying the ultrasound, so it may irritate the skin, so we will cover it by the sheet which is polyurethane or polyacrylamide agar. Okay, another important thing that I want to add in the ultrasound application over a open wound is that we can fill that open wound with the sterile saline before placing the dressing. That is, we will first of all fill the wound with the sterile saline, then we will place the dressing, and then treatment head is placed for the application. So these are the four main types of application. Okay, so after this we need to understand that part, that is preparation of patient, preparation of apparatus. That is quite simple, but there is one important thing in that part, which is the testing of apparatus. So as you can see in the image, that for testing the ultrasound before the application, what we need to do, we put the transducer head inside the water basin, and there is a mirror on the opposite side, so that the ultrasound radiation is falling on the mirror at the 45-degree angle. That is, mirror is at 45-degree angle, and it is so that it can reflect the ultrasound wave upward, which will produce ripples on the surface of water. So by this method we can test the machine, that either our ultrasound machine is working or not. Okay, so these are the main method of application. Okay, you need to understand that which type of method is used and why. Direct contact, it can be used on most of the body part where there is no bony prominence, that is muscular tissue is present. Water bath, bony prominence along with a lot of tenderness. Water bag at bony prominence. Then this polyurethane or polyacrylamide agar, which is also written in some books as solid sterile gel as couplet. Okay, so that is used for the open wound. Okay, so this was about the lecture. We have completed the method of applications. So till then you keep on studying. Thank you to one and all.